Assalamualaikum and hi, my name is Siti Nur Alia binti Ramdan and I am going to talk about introduction for menstruation. So, what is menstruation? Menstruation, or often known as period, is a regular vaginal bleeding that happens once a month as a part of a woman's cycle. Every month, woman's body will experience hormone changes for menstruation. If fertilization does not take place before the menstruation, the corpus luteum ruptures at the end of the luteal phase, and progesterone and estrogen levels decrease significantly. But if it otherwise, which is the fertilization takes place, the growing embryo will implant in the endometrial wall and produce hormones to keep the corpus luteum alive. So basically, periods happens around the age of 11 and 14 and lasts until menopause, which occurs around age 51. Usually, periods last from 3 to 5 days, but it depends on the body itself. Sometimes, period lasts longer until more than 10 days. Before having period, premenstrual syndrome, or known as PMS, is a series of symptoms that begin ahead of menstruation. Both physical and mental symptoms may be present due to the change of hormones in the body itself. It may consist of cramp in pelvic area, pain in the stomach, lower back and legs, or a constant ache in the body. Next is the objectives. The objectives are to study about the causes and effects of menstruation, to learn about the basic knowledge of menstruation, and to study about the treatments to relieve menstrual pain.
My name is Nur Shamilah binti Hamdan. So I will proceed to the next part, which is problem statements. So firstly, the problem that we can see is that our respondents don't know that menstruations can also give rise to the chronic disease. For sure, they have to consult with the doctor when having a serious or chronic menstruations. So secondly, maybe there are confusion in selection of the appropriate medicine when they're facing the menstruations. It is because there are a lot of solutions to suffer the menstruations, so they have to choose it properly. So that's all for me. So I will pass to the next person.
Hi, my name is Nabila. So I'll continue for the next part, which is methodology. So for conducting this survey, we use Google Form and WhatsApp to get a respondent and answer from our question. Okay, so the objective of the questionnaire is the first one for the personal respondent background, and then we want to know the basic knowledge about menstrual. Then is symptoms, how respondent diagnoses the pain, and then symptoms that respondent face, and the severity of the pain. Next, we want to know is treatment. So we want to know the respondent menstrual pain relief tips. And lastly, the initiative, which is period poverty initiative, to know the understanding about period poverty and how to help period poverty among youth. Okay, next we move to the chat from our respondent through WhatsApp. So this is the respondent 1 and this is respondent 2. Alright, so next we move to the results and discussion part.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Zulekha binti Zulkifli and I will discuss the questionnaire about the symptoms before menstruation. So the first question was, do you think menstrual pain is normal? Most of the respondents choose yes as their answer, where we can see that more than 70% answered yes, 50% answered no, and 8% answered that they are not sure. So menstrual pain is actually known as dysmenorrhea, which means pain in abdomen, pelvis, lower back or thighs that occur before or during the menstrual period. Therefore, it is not normal to have menstrual pain every day, but for 2 or 3 days of menstrual discomfort is considered to be normal. For the next question, which is how long does your menstrual last? The result from our respondents showed that the most of them have their menstrual for 3 to 5 days, and there was 37% that have their menstrual for 5 to 7 days, and a few respondents have their menstrual for more than a week. So actually, this menstrual can last between 3 to 8 days and usually lasts for about 5 days only. So the 3 days of bleeding may seem short, but it's still considered normal as long as she menstruates regularly for every month. However, for heavier or longer periods can increase the chances of anemia. So when the period bleeding more than 7 days, it is called as menorrhagia, which caused by hormone problems, problems with the uterus, and other health conditions. Menorrhagia can increase the chances of anemia, where a condition the red blood cells do not have the capacity to carry the oxygen to various tissues throughout the body. So next question is, what are the symptoms that you get before menstruation? Here we obviously see that mood swings have the highest percentage, which is 80%, and 66.7% for acne, and 60%, 42%, 35% for food craving, headache, and swollen wrists respectively. So why they get these symptoms? For mood swings, the insufficient amount of serotonin may contribute to premenstrual depressions, while for acne, the estrogen and progesterone levels drop can trigger the sebaceous gland to secrete more sebum, which is an oily substance that lubricates skins. And for food cravings, the fluctuating hormones and serotonin levels are to be blamed, as the hormone changes can cause a drop in blood sugar level, which leads to sugar cravings. And then, for headache, this happens because of the natural drop in estrogen level. And lastly, the swollen wrist. The fluctuating hormones level account for most of breast swelling and tenderness, where the estrogen causes the breast duct to enlarge and the progesterone production causes the midlines to swell. So that's all from me. Thank you.
Okay, next, dysmenorrhea versus the prevention. So there are two types of dysmenorrhea, which are primary and secondary. Primary dysmenorrhea is the most common kind of period pain. The cause is usually having too many prostaglandins, which are chemicals that the uterus makes. These chemicals make the muscles of the uterus tighten and relax, and this causes cramp. So for my part, I will explain the prevention of dysmenorrhea. Firstly, let me show you the questionnaire about prevention of menstrual pain and the respondent from the students that we got from the survey in the Google form. Alright, so for the first question is, do you know any menstrual pain relief tips? So as you can see here, most of the respondents chose heating pad as the tips for relieve the menstrual pain, which is about 46.7%. Alright, so the heating pad. So basically, prostaglandins are released, which can cause painful contraction. So what the function of heating pad? So the heat from the heating pad actually can help relax the muscles contributing to cramping. For example, myometrium or smooth muscles of the uterus. Next, a heat also naturally increases blood flow to the site of the pain. So when you apply heat directly to the cramping area, the blood vessels will begin to dilate and allows more blood flows to uterus. So that's how the heating pad functions. Alright, so next question is, do you think that you have to see doctor if you have unusual menstrual pain? So as you can see here, about 55.6%, the answer is yes. Alright, so why we need to see doctor if we have unusual menstrual pain? So firstly, let me tell you what's a normal period and what's not. So for the normal period, there are only 3 times for a woman to have irregular but completely normal period. Firstly is after first period. Second, first few periods after miscarriage, abortion or childbirth. Next is before menopause. And then what's about not the normal period? First is when the woman having period more than 2 weeks. Next, heavy and painful bleeding. Next is bleeding between periods. And lastly, missing period for a month or more. So if we have one of the symptoms, we have to see doctor to prevent from disease like endometriosis, uterine polyps, and fibroids. Lastly, the question for prevention is, did you count your period days by calendar? And as we can see here, the respondents, most of them also answered yes. which is about 75.6%. So counting period days by calendar is one of the ways to prevent menstrual pain, because we will know the date of the period will start, and from that we can make all the preparations to prevent menstrual pain. Alright, so here's some preparation that we can try to avoid the menstrual pain. Alright, so for the first is exercise regularly. So physical activity will help and ease menstrual cramps for some women. Next, we can try dietary supplements because a number of studies have indicated that vitamin E, omega-3 fatty acids, vitamin B, thiamine, vitamin B6, and magnesium supplements might reduce menstrual cramps. And lastly, we have to reduce stress, because psychological stress might increase your risk of menstrual cramps and their severity.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Hazwani binti Masya. My matric number is 2020-827182. Now, I'm gonna explain to you about the last part of our discussion, which is for initiative for the menstrual pain or menstrual cycle, which is about the period poverty awareness. Did you know is 1 in 7 girls have struggled to afford their sanitary wear? Did you know 1 in 5 girls had to switch to less suitable sanitary wear due to cost? And did you know more than 10 girls has to improvise sanitary wear due to affordability issues? This is clearly an issue that needs to be tackled to do so many menstrual that help perpetuate this problem. Lack of education and conversation around the periods can give rise to shame about this perfectly natural, healthy bodily function. In turn, this pushes the conversation away from period and prevents girls and women feeling comfortable for asking what they need. As we know, the period poverty reaches far and wide, having a negative impact not just for girls and women, but society as a whole. Education and works. Many girls miss out on education because of their period. Almost half of girls have missed an entire day of school. This leads to around 137 girls missing school each year, which could have a lasting impact on the girls' education, especially if days are missed each month. A study conducted in the Netherlands of 32,000 women indicated that 13.8% of women have to miss work due to their period, with 3.4% missing work every month. But then, when the women were working during their period, over 80% found it harder and wish they had more flexibility on their tasks and working hours. This is caused an economic impact through the loss of productivity, as schools and workplaces don't take into account female menstrual health, despite it affecting a large chunk of the population. Greater flexibility and more open, honest conversation about menstrual health could help to address this issue. For this project, we have asked our respondents few questions about their awareness due to the period poverty. So we had 3 questions about the period poverty, which is firstly, we asked them if they aware about the period poverty in Malaysia. As the result, we had 62.2% of them know about this problem, which is slowly rising in Malaysia, and another 37.8% they didn't know about this case, which is period poverty in Malaysia. The next question, we asked them about their understanding about the period poverty in Malaysia. We have 4 answers, which is firstly, all ladies could not afford the basic sanitary pads. Secondly, the ladies who had no idea about the period poverty. Thirdly, the ladies who had suddenly have a period week, and the fourthly, ladies who doesn't have a sanitary pad during their period week. So in this question, we know that almost 70% of the students know about this issue, which is the correct answer is the ladies who cannot afford the basic sanitary pads due to the poverty. For the last question for this discussion, we asked them about the initiative for the government or the whole community to improve the period poverty in Malaysia. So we had variety of answer, which is the most of them answers that we have to give sanitary pad subsidy, which is in 2023 our Health Minister Dr. Zaliha had this initiative in their minister office. Previously, the government had provided monthly assistance of feminine hygiene kits to 130,000 teenage from the B40 group under the budget 2022 to reflect its concerns over the issue of period poverty, which is at alarming level in Malaysia. The Selangor government, through its recently passed state budget 2023, has allocated 200,000 to empower women, including through an awareness campaign and the provision of free sanitary pad, making it the first state to introduce such as an initiative. Meanwhile, the Health Ministry has introduced body cameras for its enforcement officer to ensure transparency and to keep themselves while they carrying out their duties.